Understandably, our colleagues were devastated. It is a terrible thing. That poor man. He was peacefully sleeping off a night of drinking outside the Sioux Hotel. One elder we were working with added, he was killed by a bunch of white kids, all sons of prominent families. They kicked him to death. And then their parents have the nerve to try and get a native rights lawyer to work for them. The town was divided down racial lines. The white refrain in town was that the boys shouldn't suffer for a foolish mistake and lose their bright futures. Many First Nations concluded that this was yet another racist murder. Leaders in these communities are under tremendous pressures and themselves have often had difficult childhoods with residential schools, single parenting, and poverty. Alcohol was not unknown with these chiefs. Gender-based violence occurred. I myself once experienced a colleague who was drunk and reached over and grabbed my breast in a public gathering. I smiled through this challenge to the dignity of both of us and said nothing. I was to start medical school the next year. This work was important to me. It was why I was going to train to be a doctor. Again, this is not culturally specific. In 75% of the developing countries I work in, the majority of women think gender-based violence is acceptable. Many of the efforts to provide health care to Indigenous peoples have been colonial and destructive of culture, and yet it is the strengths of community and tradition that have proved the most promising in helping to build First Nations, Inuit, and Métis identities and close the gaps in health status with non-Indigenous people in Canada. Footnote 3. When well-meaning, non-Indigenous governments sent in teams of crisis workers to an isolated community in the midst of an epidemic of suicide attempts, insufficient consultation with the chiefs and councils took place. These workers did not have long-term experience in Indigenous communities. It was the time of the spring goose hunt. The whole community, everyone, all ages, even the dogs, set out at night for the annual traditional celebration. In the morning, the surprised crisis workers wondered where everyone had gone. Out on the goose hunt, in the midst of a community's grief, there were chuckles about how the health workers were faring alone in the community. As a non-Indigenous person writing with my own voice and through my own lens and observed experiences with other cultures, I have made many mistakes. Different worlds have subtleties in senses of humor and nuances of words that cannot be translated, which can create errors of substance and tone. I have tried to correct these with input from the original speakers, but any remaining mistakes or misinterpretations are my own. Similarly, French Canadian and Amish communities use the English language differently. In underserved ethnic minorities, it is the members of the communities themselves that create the strongest parts of the healthcare team. Whether white or First Nations, neighborhood people, in my experience, make the lives of dying people, birthing women, or ill people at all stages of their lives more meaningful and more bearable. Whether helping a Cree community develop a medical vocabulary in their own language, training Indigenous people as community-based health workers, or bringing a priest to a house call to minister to a dying French-Canadian woman, I have learned that the boundaries between physician and community are redrawn to strengthen families and their ability to care for their loved ones. Because culture itself is a determinant of health, footnote 4, respecting culture and spirituality and building on them will improve health outcomes, footnote 5. For example, working with midwives caring for the Amish minority community as they deliver their children in a home-like setting close to hospital. The issues of faith in the midst of adversity, whether professional or personal, are powerful themes in this reflective and complex memoir of joyful resilience. People who live their commitment to social justice are celebrated, whether they fight for land claims or to bring quality palliative care to all Canadians. It was a member of Parliament serving Timmins James Bay, where much of the book is situated, who was able to bring consensus in the House of Commons. Today in the House of Commons, we have all main parties, especially the government, standing up on the need to establish a pan-Canadian palliative care strategy, Charlie Angus told journalists after the May 28, 2014 vote. This is very important. It says that this government and the Federal Parliament of Canada recognize the importance of palliative care and helping find better strategies. Canadian Conference of Catholic Bishops President, Archbishop Paul-André Durocher, formerly the parish priest in my hometown, said he rejoined